Thinking to highlights of ESMO 2017, for sure the adjuvant study that were presented here at ESMO are something of really important because this will change the practice in the next months. And 3 studies were presented, the BRIMADE, COMBID, and the CheckMate 238. The first BRIMADE with vemurafenib, the data are interesting, but probably are a little bit lower interesting than from the other 2 trials. While for the COMBID, the combination of dabrafenib and trametinib gave better result than placebo. And mainly, if you look to the data of the immunotherapy with CheckMate 238 with nivolumab and versus ipilimumab in high-risk patients, this means patients with the stage 3B, C, and 4 with no evidence of disease, nivolumab gave also better results than an effective treatment like Evo. So for sure, these 2 last studies will change the practice next year. Thinking to the challenging for the treatment of advanced melanoma, what we learned in the past year is that now the outcome of melanoma patients improved a lot. If we consider that before 2011, only the 25% of patients were allowed to 1 year, and now we know that probably about 50% of patients may be a long-term results, sure, great success. Anyway, if for the 50% of patients we can reach a long-term benefit, there is another 50% of patients that still die and still with a bad disease. That said, I think that the challenge will be to overcome resistance with target therapy and to think something also to overcome resistance to immunotherapy and mainly to think of something else about the so-called refractory patients with immunotherapy, because with immunotherapy the long-term benefit is really in one of the important characteristics of the immunotherapy, and we should also do something in order to increase the number of patients who can have long-term benefit and reduce the patients who are refractory. What is important in management of side effects of the immuno-related side effect are 2 things. The first, the early diagnosis. So it's important also to have a good connection with patients, network, nurses, patients, informative material that can help for the early diagnosis. Because early diagnosis is one of the first important steps in order to solve as soon as possible this kind of side effect. The second is to start as soon as possible with immunosuppressive treatment with steroids. And of course, we need also to diagnose that the side effect is really immuno-related side effect. And experience is really important. What I can suggest is to create a network among the different institutions, where the institution with a lot of practice, of course, can learn or suggest to all the other what to do in particular cases. What is really exciting in the field of melanoma for the next year are the new possible combinations. And mainly in the field of immunotherapy. During this ESMO, we saw interesting data with the combination of pembrolizumab and IDO. Another interesting and promising combination is that with the nivolumab and an anti-LAG3 that now is called relatlimab. So again, this last combination showed a 45% of tumor reduction in the LAG3 positive patients. This may be another important mark in the future, but these patients were heavily pretreated patients. So again, there is possible some interesting news that may be good for patients and that can increase the number of patients who can have a long-term benefit.